First of all, thank you guys for this opportunity to get to present our product to you. There's a couple things about Mindray that I want you to know right off the bat.
Okay.
There are two things that are very important to us, and the first is customer service. The second is that we have easy-to-use products. Mindray has been around for approximately 45 years. We're a 100% medical company. We are the third largest medical company in the world. In addition to our monitors, we sell ultrasound, we sell anesthesia, and we are currently working on a full source solution. Now, to recap our discussion the other day, Marcia, we're looking at a 20-bed PACU, is that correct?
Yes.
Okay. We have older Space Labs monitors that are you're looking to replace, hard to find parts for, so forth. EMR technology is important.
Yes.
Okay. Big numerics. Take it. You want to be able to see things from a distance. You got a timeline of approximately 4 months till you're looking to purchase, and you are budgeted.
Yes.
Okay. We're looking at 3-lead ECG, NIBP, Masimo SpO2, one invasive art line. Microstream CO2 is what we talked about the other day, and we thought that that was important because you're going to be dealing with patients of all sizes. It's a plug-and-play unit, which is going to save you time, or a piece of technology. It's disposable, and there's no cleaning. So I think that, you know, you're used to side stream, and Microstream is really going to help you out in that sense.
Okay.
Now, it's my understanding that you want roll stands for all these?
Yes.
Okay. Well, what I want to do now is show you the monitor that I think is going to best be suited for your purpose. And what we've got is the Passport V. It's got a 12-inch screen. As you can see, it's a very colorful, it's bright, it's a good-looking monitor. If you look on the right side of the monitor, you've got your power button, got your recorder. On the left side, we've got color-coded connections. You've got your pressures, you've got your temperature, ECG, SpO2, your Microstream CO2. And what's neat about these is they're a plug-and-play. It's a plug-and-play monitor. What that means is that anytime you go to, say, hook up your SpO2 to take a blood pressure, all you do is plug it in, it'll automatically come up on the screen. You don't have to go through any settings. So it's really easy, quick, save you time.
That ECG waveform is very hard to see.
Kind of hard to see? Okay, we'll get to that. We're going to, down here under ECG, you can hit View. That's going to bring up your numerics, give you large numerics. Having a 20-bed PACU, you might want to view a monitor from another station or from just another bed.
Is that where the blood pressure goes down on the side?
Yes, right down here is where the blood pressure would be. If you want to start a blood pressure, all you do is hit Start button under NIBP.
Okay.
It's going to chime when your blood pressure is finished. You say you want to set an interval on your blood pressure. There's an interval button here. All you do, it cycles through anywhere from 1 minute to 4 hours, and every time you touch it, it's going to progress in time, and it circles around. If you want to mess with your alarms, they're right here. If you need to print, it's right there. As far as trends go, you have a trend button right here. Push that trend button, and it cycles between quick trends, list trends, and graphic trends, which I think you'll be using.
And what was quick trends? I'm sorry.
Quick trends?
Yeah. What is that?
It just gives you a snapshot of your trends. It's not a full waveform.
Okay.
Now, if you want to, say you have some graphic trends here that you want to print, you would just go down here to print trends, you push the button, it's going to come right out of the side of the recorder. Now, let's say, okay, we've got this up on the screen and you're thinking, well, how do we get back to our normal screen? Right here, you've got a big normal screen button. Punch it once, you're back to your big numerics. Punch it again, you're back to where we started.
I still have a hard time seeing the waveform, like the QRS of the waveform. Looks really tiny, if at all, from back
Can
here.
you make the waveform bigger?
You know, you can. This monitor is new to me. I'm new to this job. At a later date here, I can go over some of those details with you, but yes, we can adjust that.
Seems like you just be able to adjust the size of it.
Yeah, I'm sure that you can. Let's see.
Is there a button
Maybe
on
a
the
size
left
button
that
or
says
something?
size?
There you go.
But okay, so right under ECG here, it's even easier than I thought. As you press the size button under
There it
ECG, you're
is.
going to notice the waveform growing in size.
Oh, it's easier.
There we go.
Like that?
That looks normal.
Okay. All right.
Thank you.
Well, I hope that I've shown this Passport V to be easy to use and that it's a time saver. Do you guys have any questions?
Can I see what the CO2 waveform looks like?
Yeah, we need capnography, so
Okay.
tell me about how you monitor the CO2.
Well, we have the microstream CO2, which we talked about earlier, and what's great about it is that it's a linear bleed process. It's not a stair step. So
For
if you
your
need,
CO2?
oh, I'm sorry, I was talking about SpO2.
Oh,
Yeah.
okay.
Yeah, for your CO2, we were looking at the microstream, which benefits you because again, all patient sizes come in there in the PACU. It's plug and play. It's going to save you time. It's got disposable products, no cleaning.
Okay. And would I get the waveform up on the screen?
Yes, you would. Yeah, you just plug it in and it's going to pop up.
Oh, okay.
Yeah, you don't have to go through and configure the monitor to recognize, the fact that you're going to plug something in. So very quick, no thought involved.
Okay, I like that. And what about invasive blood pressures? We do one rarely, but yet we still do it. So what is
Okay.
how do you monitor
On the
that?
left side of the monitor here, you've got your invasives here, and you actually have the choice of two. So it sounds like you're rarely going to use one, but it comes with two anyway. So it gives you some room there to expand if you needed to.
And how do I bring that up on the screen?
Again, you just plug it in. It's going to pop right up. You don't have to configure anything.
Okay. Alrighty.
All right, we can.
Yeah.
Yeah, we'll
Okay.
just.
Okay.
It's okay. We can stop. We can come out of the demo roll. So, where do you think you're at?
You
I'm
wanna
not gonna.
sit?
I'm not. Yeah, just go ahead and sit
Let's
down.
just sit down.
We'll. I know that this is very new to you, and we're torturing you right now. It's probably
Okay,
feels
well
like
for me, the product knowledge, I wrote a lot of stuff down. Looked at my notebook a lot more than I would definitely want to in the future.
Okay.
I would want to have it there as a reference if I forgot something. Right now, I'm looking at it quite a bit. As far as presentations are concerned, this is really, other than what we've done in class, I think I gave a 2-minute speech in college one time, so getting
Okay.
up in front of people is new to me, and it's going to take me a little time to get comfortable.
Okay.
First and foremost, if I can learn my product and then start to get comfortable in front of people, because part of getting comfortable is knowing what you're talking about, and not having that confidence. As I was talking to Robin the other day, she's well aware of. It makes it even more difficult to stand up and talk about something, especially not having the salesman personality where I can get up there and just talk about anything and be confident about it. But I'm going to work on that.
Okay. So we talked about in class.